Hi, welcome to Empowered PT with Dr. E. Today I'm going to show you some exercises that you can do if you've been diagnosed with a posterior or posterior lateral disc bulge or disc herniation in your low back. So the first thing we want to do is try to work our way into extension, because this particular movement will help to decrease the pressure on the disc. So if you can not get on the floor easily, just do this on your bed. But to start, what you're going to do is just start in a seated position and then try to transition nice and slow onto your stomach. So I want you to just start propped up onto your forearms, and it's very typical to feel pressure in your low back when you get into this position. But I want you to just try to stay here for a good 2 to 3 minutes before you try any of the exercises. Just lying in this extended position will unload the discs in the back and will help to take some of that pressure off of the spine. So just spending a couple minutes in this position. And then what I want you to do is now we're going to try to work our way up into a cobra position. So your hands can just go right outside of your armpits there, and you're going to just gently press up, just stopping to where you feel pressure, holding a few seconds and coming back down. Now notice my legs are staying still. You might only be able to get to here and you feel pain and pressure. That's fine, just stop. Keep your eye gaze down so you don't overextend your neck, and then return to neutral. What you should find is that the more you do this cobra position, or a prone press up as we call it in PT, the easier it gets. So these are really important to do first thing in the morning before you get out of bed. They're going to help that transition up out of bed feel much easier. So the goal is to do at least 10 to 15 of those, because they should get easier as you keep doing them. And then after you've done 10 to 15, the best way to transition out of the bed is then just kind of pushing your legs off this way, pulling your belly button in as you stand. So the next exercise we're going to do is against the wall over here. So you're going to find any wall or doorway, and you're going to just put your forearms against the wall. You want to make sure that your elbows are in alignment with the shoulders so that you aren't shrugging. Your feet should be nice and wide, wider than your shoulders. And then you're going to just push your pelvis toward the wall, holding a few seconds and relaxing, making sure you aren't tensing through the shoulders. If it feels too intense, you can just step a little closer to the wall, holding 3 seconds and back out. And if you feel like you need a little more range of motion, you step farther away. So you're just pressing in with that pelvis, moving toward the wall, holding for 3 seconds, and then coming back out to neutral. So this is standing lumbar extension, and this exercise also helps to decrease the tension in the low back. Another great thing to do for disc bulges or herniations in the back is to walk. And you want to make sure when you're walking on a flat surface, so avoiding big inclines. But even if you can get outside and walk in 10-minute intervals 3 times a day, it will really help to get more extension into your back and to take a lot of that pressure off of the discs. Make sure that you're avoiding sitting for longer than 30 minutes at a time, and that when you do sit, you have good low back support. You can check out my ergonomics video on that. And you want to make sure too that you're avoiding any bending from the trunk. If you have to pick something up, you really want to bend from the knees, or you can hold on to something stable and keep that back nice and straight. Because the body mechanics that you use in your activities of daily living will make a huge impact on how quickly your back recovers. So please be cognizant of your body mechanics. You can perform the prone press up and the standing lumbar extension exercises 5 to 6 times a day. And you want to just keep the reps anywhere between 10 to 20 repetitions per your tolerance. Also, don't forget to utilize ice on the low back, 15 to 20 minute intervals, and you can also do that multiple times a day, lying on your stomach with the ice over the area where you have pain. Thank you so much for joining me today. I look forward to seeing you on the next video. Have a great day.